All right, welcome back, Radicals. I'm Dave. You have reached the Radical Independent. The only channel here, well, I don't know about the only channel, but I'm going to boast. I'm going to say I'm pretty much the only channel that is completely untethered to any political philosophy, although I do consider myself kind of a recovering serial conservative type guy. I am now a progressive type guy with a few leftover conservative enzymes, which at times inform my perspective. But I am open to arguments. Yesterday was a day of arguments all over social media, as we found out that Bernie supporters are quite willing to throw Tulsi and her supporters under the bus, when I think the two camps really need each other. Otherwise, the so-called progressive insurgency that many believe could be happening within the Democratic Party, but quite honestly, you can't have a revolution in a counter-revolutionary party. So these folks tend to be kind of like individual outposts for sanity. That's what they end up being. These candidates running like Tulsi and Bernie, and there are some congressional candidates that have begun following me over on Twitter. I am with you, but I'm not with identity politics. I'm not with platitudes. I had a Senate candidate from Texas who I said, what are you loyal to? I asked a simple question. And then she went off and talked about what she was loyal to, which I think is great. But the point is, I'm not into people saying loyalty is a great thing, or having integrity is a great thing. Well, explain yourself. What type of integrity? I mean, integrity can mean a lot of different things nowadays. In fact, any word that's thrown out there as a way to kind of say, well, I'm better than everybody else. Well, tell me what makes you have integrity. See, I don't see any other candidate like Tulsi Gabbard. I just don't. I don't see any other candidate that's even remotely close to Tulsi. Anyway, my friend Alan sent me this because he knows a thing or two about healthcare. And this is what I got out of this article. Understanding the differences between universal healthcare, Medicare for all, and public options. He explains this really well, and I would recommend the 6-minute read that it would take to be informed on this. Okay? Confused about all the Medicare talk? Don't be. The legislation is fairly clear. In a previous article, I've described the reasons as to why single-payer universal healthcare is the most effective way to provide healthcare to all Americans. In another article, I discussed the role of private insurance under the implementation of both the House and Senate plans. Did you hear what he just said? Private insurance plays a role in both the House. These are the current bills, Bernie folks. A lot of you don't realize the fact that, and again, someone sent me a message saying, we need to talk about what Tulsi said in that last sentence when she was talking about her plan. Tulsi's plan is right here. It's the same thing. Now, she has a different name for her plan, like she's had different names for her legislation that she's sponsored. Okay, that a lot of times she's all alone on this stuff. So both the House and Senate plans have some private insurance going on. Unfortunately, this is a good paragraph here, we have stopped applying critical thinking and dive in deep research before believing something. So we no longer do any research. What we do now is we go tribalist. We say, well, Bernie's the only one who wants to eliminate insurance companies. Not according to the bill. Not according to the plan. The truth doesn't work that way. I'm just going to keep reading here because I could do a lot of commentary, and I'm trying to read the article because Alan is great. He does a great job here. Truth is independent of beliefs. Okay? That's an important distinction. This is important given the outrage and polarization in the implementations for universal health care. Now, I tell you what, the cancel culture, the outrage culture, it's a real thing. Sorry, Kyle Kalinske. I know when conservatives point this stuff out, all of the progressives go, oh no, there's no outrage culture. Oh really? Go on to Twitter. People get outraged over things that they don't even understand. And this is Exhibit A. But he goes on here and he does a good job. Why people are passionate about this subject? Because it is literally a matter of life and death. So, I get that. But it doesn't preclude the idea, it doesn't obfuscate the idea of doing research. Okay? If you haven't done research on this and you're spouting off about it, I can't help you. Alan here is trying to help everybody. But we also need to be objective and look at the facts to clearly define what we want, what is possible to get, and how to achieve it. Oh no, here we go. So Alan here is basically saying in this sentence, and a lot of progressives would read it this way, they would say, no, he's compromised. He wants us to compromise. He wants to do neoliberalism. This is what the interpretation would be. All of a sudden, Alan is a neoliberal because he's talking about what we can achieve, how to achieve. Oh, you can't, people will go back to that Obama analogy of the big ocean liner and trying to turn it. This is a little different because it's in the bill. Right now, it's in the bill. So if you're a Bernie fan, and you haven't read the bill, read the damn bill. First, a few definitions. He goes into what single payer is. An idea in which every single doctor and treatment is covered under a government-sponsored program, leaving no room for private insurance because it is prohibited by law. All services are covered, and all providers are forced to accept it. This would be utopia, except the idea that maybe the doctors wouldn't be all in on this. But I'll come back to that. A program, this is Medicare for All, a program in which every American contributes a portion of their income, and in exchange, a large number of life-saving and life-prolonging treatments are made available without additional cost. Medicare Choice. This is Tulsi Gabbard's term. All right, a term coined by Representative Tulsi Gabbard to expand over the universal single-payer system, recognizing that there are additional healthcare services that are not covered under Medicare for All. Okay, so this is the crux of everything. So if you're arguing that Tulsi doesn't get it, she's compromising, she's Elizabeth Warren, or whoever, she's Beto O'Rourke at this point. No. The way Alan explains it here, and it's easily understood, is that she's recognizing that there are additional healthcare services that aren't covered under Medicare for All. Because it's actually in the bill. It's in the bill. Public option, a term defining the coexistence of publicly funded healthcare and private insurance, both serving the same needs of the patients, with the ability to select one or the other. Current system. Healthcare insurance is private, and only elderly or the poor have access to programs to partial healthcare coverage. All right, so that's how we understand what's going on. He's got a little graph here, a little chart, tells you what is covered, what's not covered. Probability in reducing overall healthcare costs. Universal is the highest. Medicare for All is high in the House, and this is the Senate version. Public option is low. Current system is the lowest. Current system. In our current system, nobody is forced to participate, but that also means that if you don't participate, you are not covered unless you are old or very poor. We clearly need something better than this. Now, I'm skimming here. A public option. Why is a public option popular with insurance companies? Assuming they are forced to accept some form of government interference, a public option is actually a way to privatize profits and socialize risks. Why? Because a public option will need to accept any American, independent of health condition. Under a public option, private companies can create insurance plans targeted to healthy and young populations. They would appear to be the most cost-effective because they will only apply during the low-cost lifetime of the patient. Once a patient becomes chronically ill, insurance companies can raise premiums so that it becomes impossible to afford them, and then people will move to the public option. Because the public option will be biased towards less healthy people, its costs will be higher, and it will give the appearance that the public option is less cost-effective than the private option. This, in turn, can be used as evidence that the government is ill-suited to provide health care, thus reducing widespread support of a universal health care option. It's like a Trojan horse. People will think, if not even the public option worked, how can we expect a universal single-payer system to work? And I didn't even read this yet. A public option is the Trojan horse. Medicare for All Senate version. Every American pays into the system. Every American receives very generous and life-saving treatments. Under this program, no American will die for the lack of coverage or go bankrupt. Look at the legislation, because healthcare providers need to opt in the program. Only those healthcare providers who opt in the program will be covered under Medicare for All. Do you understand that the healthcare providers aren't going to change? All right, they're going to opt in or not opt in. See, the government doesn't just come in and create all brand new healthcare providers that are attached to the government somehow. This means that there is a real possibility that your doctor may choose not to participate. Again, these are details that are really important, and Bernie supporters should be careful what they say. That's all I'm saying. It will leave you with two options: pay the doctor directly or buy a private insurance that covers your doctor. We see this now. What doctors take what? You can't start telling, unless you, again, come in and start controlling and telling the doctors that they have to take this. And the doctors can quit. They don't have to do this kind of work. At this point, people are going to say, but hey, this is a non-duplicative care provision. You cannot get private insurance. You'll be wrong. And this is the biggest misconception. The legislation is very clear. To something be considered covered, the service and the provider need to be covered under Medicare. If the service or the provider is not covered under Medicare, then the provision of private contracts kicks in, opening the door for private insurance and cash payments directly to healthcare providers. For more details on the differences, you can refer to Alan's previous article. As stated in that article, the Senate version allows healthcare providers to select the procedures they want to cover under Medicare for All, which can cause a ramification in the quality of service that a healthcare provider will give to a patient. Seems to me that there could be a flaw here in Bernie's bill. Bernie at both bills, the Senate and the House version. Can it create a tiered service among Medicare health care providers? Yes. Does it mean the program is worthless? No. Here's the House version. Similar to the Senate version, the House version, healthcare providers cannot pick and choose which services they will cover under Medicare. It means that if they provide one service, they must accept Medicare payment and are prevented from taking payments. In that sense, it is impossible for this program to encourage a tiered service by healthcare professionals taking Medicare. Can it create a tiered service among Medicare healthcare providers? No. So that's a good thing. Does it make the program worthless? No. Now, Medicare choice. Tulsi Gabbard's interpretation of the House Medicare for All bill. So Tulsi's is similar to the House version, which is better than the Senate version, which is the Bernie version. Tulsi has been very clear that Medicare for All will provide a base level like the House and Senate do, and people are free to buy private insurance like the House and Senate legislation allow for. So again, for all of you Bernie people that are attacking Tulsi Gabbard's plan, based on what Alan is saying here, and take it up with Alan, take it up with the bills, it appears that Tulsi's bill is similar, if not better. Okay? Because, again, and folks, if you don't want private insurance involved in this, I get it. All right? Everybody is angry at private insurance because they're greedy and they're making money off the backs of sick people, which is immoral. Okay? We can say that. It's immoral. Let me go on. The choice is not about choosing between public and private insurance. It is about choosing to get or to not get private insurance. Public insurance is a given. You are covered. You pay into it just like people pay property taxes, school taxes, and can choose to send their kids still to a private school. Has anyone filed a bill, by the way, to eliminate private schools? No. No. People just want to have the option of going to like a free state college, which I support. I do not support abolishing private schools. And I don't, again, people will say, well, that'll hurt public education. Well, you know, if it's funded and we take money away from the military-industrial complex, we can actually have both. And then there'll be real competition, and the public entities will certainly work and try harder to get students into their institutions, you would think. I don't know. The bottom line is, again, Tulsi Gabbard has said people deserve to have choices if they want the choice. And you may call that like free market. I don't know what you want to call it. Freedom. Just call it freedom, because that's what it is. You always have the option to take your children to public school, but you may want something different. What if the only public school in your area stinks? You have no recourse. We see this all the time in the inner cities. And you would say, well, we need to dump more money into it, get better teachers, blah, blah, blah. That's all well and good, and it's something that you might want to do. But these institutions, you know, they're the ones that are like the Titanic, and they're impossible to steer and move. Things don't happen overnight. So anyway, in fact, the way Tulsi is representing her healthcare position is most consistent with the bill she voted for in the House. There is no inconsistency. And I already just told you, I think the House bill is better than the Senate bill. And I think Tulsi's version of the House bill is better than the House bill, the current House bill. So we get to universal single payer. This is the best. Nobody's going to claim this isn't the best. This isn't what these bills are, though. This is the dream in which every American pays into the system. Every possible healthcare service is provided free of charge at the point of service, and all healthcare providers are forced to take only Medicare at the reimbursement rates the government decides. He goes on, though, to say this is extremely dangerous. It will severely cripple our ability to convince people to go into the medical field. It is a major violation of the rights of healthcare professionals, even when the end result would be the best for the rest of the population. But practically speaking, without healthcare professionals, there is no healthcare. And this is why the Medicare bills, both House and Senate, are the best realistic and practical implications of a system that approaches this ideal. And he goes on, I am really disappointed many politicians and news personalities who claim that Medicare legislation in the Senate or the House is an implementation of a universal single-payer healthcare system that will completely make private insurance redundant and illegal. they're basically telling you something that's not even in the bill. They're misrepresenting the bill itself. He says, my only plea is to read the legislation by yourself. You can use this article as a starting point, and you have a link here to do that. And make sure that what your politician or favorite news person is telling you is consistent with the legislation that they are claiming to support. Both the Senate and House bills are good bills that will help us lower costs, make our economy more productive, and reduce the pain and suffering of millions of Americans. They are both good bills, but please, let us represent them accurately. All right, so Alan, I think, just absolutely annihilates this notion that Tulsi Gabbard and her proposed bill, her version of the House bill, is somehow inferior to what Bernie Sanders has proposed, and that Tulsi Gabbard somehow doesn't understand this and is trying to, what's the word? Court private insurance companies. She's trying to kind of acquiesce to private insurance. That's ridiculous, people. And this is one of the reasons I had kind of a tough day on Twitter. Now, the universal healthcare system is a dream system, but the problem is healthcare providers will probably not want to do healthcare in this situation. I think, especially in this political climate, and if you want to call this compromise, imagine getting one of these programs implemented. This would be a happy day, because Americans who couldn't get any health coverage at all could get health insurance, and they wouldn't have to pay for it. People would pay, some higher taxes, but they wouldn't be subject to these ridiculous premiums and deductibles and all these rules and stuff. And the progressive movement, I'm going to wrap up here because it's a long video. Progressive movement, as it's being portrayed right now, or at least how it's interacting with itself, is going to implode. It's going to implode because there's kind of this self-righteousness it's anger, it's kind of like a blinding rage. It's very similar to the people that just hate Donald Trump and are willing to waste taxpayer dollars and endless amounts of news cycle in print, endless amounts on why Donald Trump is the worst person who's ever lived. And as much as I dislike Donald Trump, we can see that sometimes arguments tend to blind people from facts, and emotions and anger and frustrations. Those things cause people to, I guess, go into a different place where they can't be reached. And then it becomes very argumentative, it becomes very mean-spirited. People then begin to speak in platitudes back to you. And even though they go after other politicians for speaking in platitudes, they're doing the same thing, and it's not a good look. And if it keeps up, the Tulsi supporters are going to take their ball and they're going to go home. They're going to go to the Green Party. They're not going to vote for Elizabeth Warren. They're not going to vote for Bernie Sanders. Some of them might not vote for Bernie. I'll still hold out hope that I would maybe support Bernie Sanders. But Bernie needs to come out and be clear on this. Tulsi doesn't need to defend herself because it's right here in black and white. Anybody can go look this stuff up. And if you're going to disparage Tulsi Gabbard because she's not all in, she's not down with the struggle on Medicare for all, then you don't know what you're talking about. You have no idea. And go back, do some research like I did. Alan does a great job here. You can follow Alan on Twitter. His last name is spelled Myron. This is somebody who's intelligent, informed, and is calling out a bunch of people who are yelling and screaming because they obviously haven't read either the House or the Senate bill. And quite honestly, the House bill appears to be better than the Senate bill, and Tulsi's version of the House bill appears to be better than both of the bills. It's like Tulsi's off fossil fuels bill, which is miles ahead of the Green New Deal, because it's actionable stuff that we can do rather than some non-binding resolution, which is more or less just a kind little ask of countries or companies. Hey, we'd like to do this new Green Deal thing. Would you guys be interested? Tulsi Gabbard's is a binding piece of legislation. All right? So, very long video. I typically don't do videos this long, but this one warranted a comprehensive response, and I have a great article here and a great source. So do your homework and then come back and scream if you still want to. But I'll tell you what, this movement, it's going to implode in on itself, and nobody's going to take us seriously. And I would consider myself in the movement, but I am not in the movement where I'm dogmatic and I can't look at an issue objectively and see where strategically that issue is going to do harm to the movement. And in this case, the Medicare for All thing, it's not an all or nothing deal. I mean, both these bills talk about private insurance. So there you go. I'm done. See y'all soon.